Welcome back. As we all know, coronavirus has made its way into the Oval Office, and that shines a bright spotlight on what we can all do to help those facing coronavirus and COVID-19. For insight on this, I'm joined by Dr. Aaron Goodhue, who's the Executive Medical Director of the American Red Cross. Doctor, thanks for being here.
Hi, Brian.
And let's talk a little bit about why these antibody tests are so important and how they differ from the diagnostic tests many have had.
So antibodies are substances in your blood that your body makes to fight off an infection like a virus. Unlike the tests you've had with a nasal swab, this is not a diagnostic test to tell you if you have currently are infected with the virus that causes COVID-19. So if you're not feeling well or have potentially been exposed to someone who's ill, please contact your healthcare provider. By using these two antibody tests, the American Red Cross can now potentially use convalescent plasma from any blood donations made at any blood drive or collection site throughout the United States. With experts telling us that there's going to be a potential second wave of COVID-19 in late fall or early winter, the American Red Cross wants to be prepared with as much convalescent plasma as possible so that any patient who in need has access to every treatment option available.
Doctor, some people report having gotten a negative diagnostic result for a COVID test, but then they end up getting a positive antibody test. Can you explain the discrepancy there?
Again, as the medical and scientific community are learning about this virus, it blindsided all of us at the same time. No test is perfect. Timing is everything when it comes to testing, diagnosing viral disease. So that could potentially be a reason why someone could say they were negative for COVID-19, even though they had a diagnostic test, and then later have antibodies to that test. The body takes a little while after it's been exposed to a virus to make those antibodies, so they don't usually surface right away. It can take several weeks to a month or so to get those antibodies.
Now, doctor, we're talking about antibodies as sort of a static thing, but they're not static in terms of their presence in the body. Is that correct?
That's a really great question, and antibodies are certainly not a static substance in the blood. Antibodies take a couple, days, weeks, months to rise to a good level in your blood after infection. Current scientific evidence from this pandemic has shown that antibodies can stay at, pretty decent levels to be able to donate convalescent plasma for 3 to 4 months after infection. This is similar to previous data from the first SARS outbreak, the SARS-CoV-1 in the early 2000s.
Doctor, you just mentioned convalescent plasma. How might the plasma help those dealing with COVID, including perhaps President Trump?
Convalescent plasma is a very historic treatment, really an old standby. It was used in the Spanish flu of 1919, used again in the early 2000s against that first coronavirus outbreak, SARS-CoV-1, and the MERS outbreak, and then recently for the Ebola outbreaks in 2013, 2014. Whenever there's a new infectious entity in the medical and scientific community, though working tirelessly, has not been able yet to make viral specific therapies or vaccines or monoclonal antibodies, convalescent plasma is the most immediate and most readily available currently therapy for patients that is actually specific for the virus.
There have been some reports on possible mutations to the coronavirus. How might those mutations impact whether the plasma remains effective?
Well, I think there's definitely been mutations in the virus still working to be identified by the medical and scientific community, what impact mutations have had on clinical disease. I cannot say definitively whether convalescent plasma collected earlier under a different strain may or may not be effective to mutated strains. The interesting thing about convalescent plasma is there's traditionally in it not just one type of antibody, but many types of antibodies. The American Red Cross is testing for 2 different antibodies to the coronavirus at this time, which is now allowing us to expand the donor pool for convalescent plasma, and we can check every donation. And in addition, even if you don't have antibodies to COVID-19 disease, we still need your blood. Every 2 seconds, somebody in the United States needs a blood transfusion, be it a trauma victim or somebody suffering from cancer who needs kind of ongoing transfusion support. We definitely need your blood product. And we would love to have you register with us at redcrossblood.org, schedule an appointment, and come on in and see us.
All right, Dr. Erin Goodhue from the American Red Cross. Doctor, thank you so much. And we'll be back after this.